Hello, and welcome to our presentation on managing rehabilitation facilities by Brianna Barone, Sarah Bringhurst, Ingrid Ferris, and Marilyn Stengel.
Let us start first by explaining the definition of a rehabilitation facility. Rehabilitation facilities are devoted to the rehabilitation of patients with various neurological, muscular, skeletal, orthopedic, and other medical conditions following stabilization of their acute medical issues. These facilities were created to meet a perceived need for facilities which were less costly on a per diem basis than general hospitals, but which provided a higher level of professional therapies such as speech therapy, occupational therapy, and physical therapy that can be obtained in skilled nursing care facilities.
What factors cause us, the healthcare industry, to look upon rehabilitation facilities differently than acute care hospitals or long-term care facilities? Long-term acute care hospitals care for medically complex patients expected to require care for weeks to months. These patients are often chronically, critically ill, most commonly recovering from hospitalizations that include an intensive care unit stay. These facilities provide services very similar to acute care hospitals, including the ability to care for patients requiring mechanical ventilation, complex wound care, or hemodialysis. The facilities may be freestanding or attached to an acute hospital, and they are subject to the same licensing and credentialing requirements as traditional hospitals. Patients at long-term acute care hospitals generally require daily evaluation by a physician. Inpatient rehabilitation facilities care for patients recovering from surgery, trauma, or an acute illness. They provide intensive rehabilitations. Patients must be able to tolerate 3 hours of physical or occupational therapy daily, with the goal of restoring patients to their pre-morbid functional status. Care is overseen by a multidisciplinary team that includes a physician, typically a specialist in rehabilitation.
Among the components of inpatient rehabilitation facilities we have physical therapy. It remedies impairments and promotes mobility. Occupational therapy, which develop, recover, or maintain LDLs. Respiratory therapy, specialized in cardiology, pulmonology, and airway management. And finally, we have speech therapy, which evaluate and treat communication solving disorders. Before talking about the components of a comprehensive outpatient rehabilitation facility, it is important to know what a CORF is all about. A comprehensive outpatient rehabilitation facility is a medical facility that provides outpatient diagnostic, therapeutic, and restorative services for the rehabilitation of your injury, disability, or sickness. These services must be provided at a single fixed location. At the very least, a CORF must provide the services of facility doctors, physical therapy, social or psychological services. These may be provided in an off-site location. In order to get services at a CORF, your doctor must draw up a treatment plan and review it at least every 60 days. Finally, here is an additional list of covered items at the CORF.
Can rehabilitation centers qualify for CMS certification? If so, how? In order for rehab centers to be eligible to participate as providers of OPT/OSP services, they must be in compliance with all applicable Medicare requirements. The three services that are required are physician services, physical therapy services, and social or psychological services. An on-site survey should be performed for all facilities applying for participation as comprehensive outpatient rehabilitation facilities. All the services provided to comprehensive outpatient rehab facilities patients must be rendered on the premises, with the exception of one visit to the patient's home for purposes of evaluating his or her home environment relative to treatment goals. A certified OPT/OSP cannot have its total premises certified as both an OPT/OSP and a comprehensive outpatient rehab facility. Comprehensive outpatient rehab facilities will not be allowed to have extension units. Provider numbers will be assigned by the regional offices, as is done for other Medicare providers and suppliers. When the completed request for certification is received, ascertain if the facility provides the three required services, and if they do not offer these three required services, they are not eligible to participate in the comprehensive outpatient rehab facility program and should be notified of this decision immediately.
If you are wondering if there is an accrediting body for rehabilitation facilities, the answer is yes. It is known as the Commission on Accreditation of Rehabilitation Facilities, CARF. It was founded in 1966, and for some institutions, it represents an alternative to Joint Commission accreditation, and its mission is to provide accreditation standards and software for organizations working in the human services field worldwide. It is an independent accreditor of health and human services in the following areas: aging services, behavioral health, child and youth services, among others.
Explain Medicare reimbursement for rehabilitation services, paying special attention to the phenomenon of a 100-day episode of acute care or rehabilitation care. Coverage and utilization patterns of SNF, HHA, and inpatient hospital rehabilitation (IHR) services under Medicare's Part A program have not been as frequently reported on as acute care hospital services have been. Although Medicare is often referred to as an acute care program, the legislative intent of SNF and HHA coverage apparently has not been generally well understood. Surveys of the age indicate that a high proportion think that Medicare covers nursing home care. Medicare coverage is an SNF is not allowed if the patient needs skilled nursing or rehabilitation services only, once or twice a week, or if the person does not need to be in SNF to receive those services. Until 1988, amendments to the Social Security Act, Medicare covered up to 100 SNF days for qualified persons during each spell of illness. 20 SNF days were without any cost sharing. The 21st through 100th days required a cost sharing amount per day. That was 1/8 of the hospital deductible. In 1988, the inpatient hospital deductible was set at $540. Thus, the SNF co-insurance was $67.50 per day, an amount that was sometimes equal to or even greater than the full S&F charge per day. Explain the role of Medicaid in reimbursing for rehabilitation services. Every state Medicaid program covers certain population groups that are defined in federal law as mandatory. Often these groups are collectively called the categorically needy. States may also cover additional groups at their option. These groups are often collectively called the medically needy. Although a subset also bears the name, for simplicity, if a state only covers the mandatory population groups, then an acronym CN appears. If the state has chosen to cover any of the optional population groups, then the acronym MN also appears. However, the specific groups covered are not identified. States with waivers may have their Medicaid populations identified differently on the tables. See the following documents for examples of groups that fall under these two groups.
Local rehab centers offer programs for the treatment of various drug and alcohol addictions, as well as psychological counseling services. Regional rehab facilities provide services for short-term care, long-term care, Alzheimer's and dementia care, and hospice.
I interviewed an administrator locally of a rehab facility and asked him regarding the challenges and opportunities of managing a rehabilitation facility. The main challenge that he expressed was patient education, and this was in regards to helping patients understand the process of their treatment plan fully and explaining the types of treatment services, the staff availability, and the rigorous therapy required for many recovery treatments. Also explaining to them their post-recovery and making sure that they were fully equipped to understand the process of not becoming re-injured and keeping up with any treatments that they were given to do once they return home. Also explaining the financial resources that a patient needed in order to cover their care, whether they were underinsured or uninsured. The opportunities, he said, that he found most beneficial in managing his facility was being a problem solver. Resolving issues was his biggest main focus on his opportunities. He said that while educating patients was a challenge, it was also an opportunity in educating his staff to ensure positive patient care overall in the long term. Also assisting patients to find the resources that they needed to help get their recovery going was also an opportunity to help those who came to his facility. He also mentioned that another opportunity was understanding the social and economic structure and cultural background of the community in order to make his facility in particular stand out and succeed.
Who owns rehabilitation facilities? Rehab facilities can be private, for-profit, nonprofit, or publicly owned by government agencies and corporations. Like most other healthcare companies, whether they are for or nonprofit, they are still businesses that need to make money to survive and pay staff. If a corporation owns many different facilities, the quality of care can usually be determined by finding out if they are in business for the primary purpose of generating a ton of revenue, or if they simply make money because they provide excellent service. There are some private companies out there that focus primarily on their incoming dollars each month and year and debate on whether or not a publicly held company has more responsibility to their shareholders or their treatment clients. Manager of rehab facilities. Healthcare administrators typically manage the facility. This is administrative and supervisory work with the duty for directing and coordinating rehab programs in an assigned district, a rehab center, or as an education director or chief evaluator. Work includes exercising line authority for developing and providing direct client services through rehab counselors, rehab specialists, and a variety of support staff.
What is HealthSouth? HealthSouth is one of the nation's largest providers of post-acute healthcare services through the acquisition of Encompass Home Health and Hospice, an industry leader in home-based patient care. Our priority is to deliver high-quality patient care, and our team of experts has extensive experience in today's most advanced therapeutic methods and technologies. HealthSouth leads the way, constantly outperforming peers with a unique intensive approach to rehabilitation, returning patients to full strength in this less average time. At HealthSouth, we continually strive for excellence in all that we do, partnering with every patient to find a treatment plan that works for them.
Rehabilitation facilities have a national advocacy organization. NARA, or the National Association of Rehabilitation Providers and Agencies, represents more than 45,000 therapists, rehab providers, and rehab support organizations across the country. They represent all therapy disciplines in all therapy settings. They also advocate both for in- and outpatient services and providers. The rehabilitation facility segment of the U.S. healthcare industry has the following numbers and patients and employees that impact this part of the healthcare industry. According to current CMS reports as of 2014, the government spends $6.72 billion in Medicare FFS payments for inpatient rehabilitation facilities. As of 2014, the number of people employed within rehabilitation facilities was over 120,000 and expected to grow 9% by the year 2022. In 2012, there were 1,166 inpatient rehabilitation facilities nationwide with over 35,000 beds and at least one IRF facility in each state. Outpatient rehabilitation is a $29.6 billion industry that is expected to grow by 7% through 2018. Outpatient rehabilitation spending is 90% in physical therapy, with the other 10% in speech and audiology. This concludes our presentation on rehabilitation facilities. Below is a list of references if you would like further detailed information. If you have any questions, please post them to the discussion board and we will answer them. Thank you.